Hello and welcome to another Facebook Live with MedStar Health. My name is Michelle Carter and I'm joined today by our experts from the MedStar Health Wound Healing Institute with locations in Washington, D.C. and Baltimore, Maryland. We're here to bring awareness about saving limbs in honor of Limb Salvage Awareness Month. This impressive group will discuss why wounds don't heal, wound care education and treatment options, podiatric surgery, and the team approach to saving limbs. So if you have a wound that doesn't heal in your foot or your leg, stick around, share this broadcast with your friends, give us a like to let us know that you're watching, and share your questions in the comment section below. We're going to take some time to answer those as well. Before we dive into our questions, let's meet our panel for today. So I'll start with Dr. John Steinberg. He is the chief of the Division of Podiatric Surgery at MedStar Georgetown University Hospital and is co-director of the MedStar Health Wound Healing Institute in Washington, D.C. He's a pioneer nationally and internationally for his expertise in podiatric surgery and limb salvage techniques. So welcome, Dr. Steinberg. Thanks for your time today.
Thank you.
We also have Dr. Suzanne Kuhl, who is a vascular surgeon with the MedStar Heart and Vascular Institute, Baltimore region. She practices vascular surgery at MedStar Good Samaritan and MedStar Union Memorial Hospitals. Welcome, Dr. Kuhl.
Thanks for having me.
Thanks. We also have Semka Gratz, who is a certified nurse practitioner at the MedStar Health Wound Healing Institute at MedStar Good Samaritan, where she is part of the wound care and limb salvage team. Welcome, Semka.
Thank you.
We also have Patricia Muller, who is a physician assistant at the MedStar Health Wound Healing Institute, also at MedStar Good Samaritan. She specializes in wound care and hyperbaric medicine. So welcome, Patricia.
Hello.
And last but not least, we have Dan Hakim, who has extensive expertise in wound care and physical therapy. He is director of the clinical operations at MedStar Health Wound Healing Institute at MedStar Franklin Square Medical Center. So welcome, Dan.
Thanks. Happy to be here.
Great. Thanks again for your time, everyone. Let's get started with some of our questions. All right. So Dr. Steinberg, we've mentioned the term non-healing wound. So could you tell us why wounds often don't heal and who is at risk for that?
Well, again, pleasure to be here, and thank you all for tuning in with us today. Such an important topic. Non-healing wounds, it sounds like a pretty benign term, but it's a big deal. And patients that come into our wound healing centers and our wound healing institute throughout the system struggle on a daily basis, where most of us are used to the fact that your foot or your leg or your arm, if you have a wound or a cut or an injury, it will heal on its own. But in patients with impaired healing from many different reasons, diabetes being one of the most common, but rheumatoid arthritis or autoimmune disorders or peripheral vascular disease, there's so many things that can cause a non-healing wound. They require specialized care, because if that wound continues to be ignored by the body, then it doesn't heal. The body doesn't do the normal process of closing that in with a scar or a scab and eventually just things kind of taking their own course. It needs some help from the outside. And that's what you see this team on the screen here with me today. This is what we're all about, is helping those wounds move towards healing and finding the right process to take this wound that's being somewhat ignored by the body and turn it into a wound that's actively healing.
Thank you very much, Dr. Steinberg, for explaining that. Could you also define what limb salvage or limb preservation is?
Oh, certainly. As a podiatrist or podiatric surgeon, that's a big part of my daily life. Probably 80% of my patients that I see on a regular basis have diabetes, and most of them have wounds because of my practice type. Limb salvage is the medical and surgical practice of all those who see on the screen here with me from our team at MedStar Health to avoid an amputation. So it used to be automatic that if you had a non-healing wound, if it had blood flow, if it had infection, that the answer was an amputation. And that amputation was usually at the below knee or even above knee level, which is catastrophic. What we have been able to do with the team assembled here is to repair the blood flow and fix the infection and address the non-healing wound to create what we call limb salvage or limb preservation. So it's the attempt to avoid an amputation. I know we'll talk about this later, but sometimes an amputation is unavoidable, and we're here to help with that when it's necessary too, and make that go as best as it possibly can. But our goal in general is to stop the process before that happens and preserve as much of the leg as we can.
Thanks again for sharing that. Could you also explain why someone would need this procedure, the limb preservation?
Yeah, so limb preservation can be medical and it can be surgical. So a lot of it takes place in our Wound Healing Institute centers throughout MedStar Health, where you'll come in on a weekly or every other week basis for appropriate care and maybe some wound debridement where we remove unhealthy tissue from the wound, or prescribing of new dressings or medications or antibiotics, or consulting other physicians or providers that would help with the healing. But in many instances, it involves surgery. And that would be a transition to an inpatient stay where you may require an admission to the hospital. And if that happens, one of the key advantages we have with MedStar Health is our teams are streamlined so that whoever's taking care of you as an outpatient is probably the same set of providers that are taking care of you as an inpatient. So if you're seeing myself or Dr. Kuhl in our clinics and seeing us for wound care, if at some point it has to be where we have to switch to hospitalization or surgery, we're also your surgeon, which is nice to minimize the number of handoffs and have that be streamlined.
That's great to hear. And that's a great segue to my next question about the team approach. So Dr. Steinberg, tell us about that team approach to wound care and limb salvage that's available at the MedStar Health Wound Healing Institute.
Yeah, we take this very seriously. We don't just throw that term around. It really takes a team, particularly for these patients that are so challenged from the medical and surgical aspects, but also from the social issues and the caretakers and the family environment. It's a major challenge to the patient and to those around them when someone has to deal with a non-healing wound for weeks or months or sometimes years. These are a major burden. So our team is here to help to ideally fix and heal the wound, but also take care of all those issues around that that need assistance, from setting up home care nursing or having in-home physical therapy or arranging for dressing supplies to be delivered. The team approach is something we've published on, and it's something actually we have a meeting coming up this week, a major international meeting where we actually talk about diabetic limb salvage, and one of our big focuses is talking about the team approach. It's something we really, there's no place for an ego when someone has a non-healing wound. This is not my patient or your patient or someone else's patient. This is a team patient, and we all have to work together to get the best outcome. So we take that word team approach really, really seriously and try to really make that positively impact the patient's care.
I like that. I like to hear that. Yeah, many hands make light work. That reminds me of that saying, like, the team approach to care. There's different perspectives to be had, all for good outcomes for the patient. So that's really good to hear. Dr. Steinberg, could you also share why this team approach is so important versus just going to one provider for a wound?
Yeah, the number of times that I'll see a patient and go grab a colleague from the hallway or page someone or text someone to come over and help me is very frequent. And again, the folks you see on the screen here, every one of us is empowered to do what we need to do for that patient, as is the RN and the medical assistant in our clinic and the front desk clerk. Everybody has a role to kind of raise the flag and say, hey, this patient needs this done for their care and for success. So we really try to create a level playing field where everybody feels comfortable speaking up and create that environment where we have, rather than having to wait 2 weeks to see Dr. Kuhl for vascular surgery in her clinic, we can make it happen right away and see if she's available to come see the patient. If we're worried about blood flow, we can address this today rather than waiting weeks where we might perhaps have a bad outcome instead. So.
All right. Thank you very much, Dr. Steinberg, for spending time with us today. Thank you very much. At this time, I'd like to bring in Dr. Kuhl into the conversation to further talk about wound care and vascular surgery. So Dr. Kuhl, could you explain to us what conditions can occur when the blood flow is disrupted, and also how can that cause a patient to be at risk for losing a foot or a leg?
Yeah, of course. And thanks again for having me. So I would say, as Dr. Steinberg had mentioned, there's many reasons why a wound might not heal, from everything from sort of the whole idea is that you need enough nutrients to sort of rebuild cells in order to heal that wound. And so people with autoimmune disease can have issues. Many times the problem is the blood flow down to the wound, and then often the blood supply leaving the wound. So our arteries bring all of the blood flow to our extremities, and so often where the wounds are, and then the veins bring the blood flow back out of the extremity. And so for the arteries, you can have basically what we call atherosclerosis, or sort of hardening of the arteries and plaque buildup within the arteries. So people most often hear this when they have people with heart disease and heart attacks or strokes, where you have plaque buildup in the arteries to your heart or going towards your brain. But that can also occur in the arteries that go to your extremities and to your legs. And so when we are not getting enough blood flow down to our legs, we often have enough to keep our feet alive. But if we injure them, if we have pressure, if we have stepped on a nail, if we have burned our foot, many other reasons why people begin to have a wound, if there's not enough blood flow to the wound, then we can't heal it. And for the same purpose, we need the blood flow to then leave the leg. If we can't get blood flow to leave, we end up with swelling and edema of the leg. And that swelling causes basically hardening of the skin, cracking of the skin, and wounds to form in that way. And so as a vascular surgeon, I sort of help to try to do a lot of the plumbing for the wound. If there are blockages to of the blood supply to the wound, I do multiple things to try to improve that. Sometimes that can be minimally invasively and trying to basically balloon or stent open the arteries. Sometimes it requires further surgery with bypasses or sort of cleaning out the arteries to improve the blood flow. In the same way, people who have had blood clots before in their veins, or what we call venous insufficiency, if we can't get blood flow out of the leg, then there are things that I can do to try to improve the swelling in the leg in order to help with the wound healing. So like I said, a lot of plumbing, but we need the nutrients in the blood to get down to the wound in order for that wound to heal. And that's sort of the piece of the puzzle that I play apart with the other members of the team to try to figure out the other causes for the wound not to heal.
Thank you very much, Dr. Cool. That led me to my next question, which I think you sort of answered as well, about your role as a vascular surgeon in limb salvage care. So thank you for explaining those types of procedures. Thanks again. Also, how can patients prevent vascular conditions that could put them at risk for losing a limb? What can we do ahead of time?
Right. So, if we're specifically talking more about, the atherosclerosis, the plaque buildup, this is a whole body approach that, as I said, it happens in arteries throughout the body. And so it's not just about your legs, but the things that cause that are, diabetes. And so this is why, again, team approach with our endocrinologists to maintain that your diabetes is under control. High blood pressure can worsen the atherosclerosis. So making sure that your blood pressure is under control, making sure your cholesterol is under control. And so whether or not that's with diet and exercise or with medications with your primary care provider, it's sort of maintaining a healthy lifestyle and controlling some of the other medical conditions that may already exist, and making sure that we're properly caring for those. The other thing that we can do, honestly, is walking. Your body is sort of a lose it or use it, but just like you can't run a marathon the first day you run it, you have to build up. And so the more you walk, your body actually creates more blood supply down to our legs and to our muscle. And so the more we walk, the better we can maintain the blood flow to our legs and overall a sort of healthy lifestyle.
I like that approach. It's, realistic, we can walk. You don't have to run a marathon on the first day of this new exercise routine that you may want to start in your life, but walking is a good first step, literally. So yeah, thanks, Dr. Cool. Also, in your opinion, why is it so important to work with this team that everyone has all shared about? Why is the team approach so important at the MedStar Health Wound Healing Institute?
But I mean, in some ways, it's because we each have our own areas of expertise. I think about it like if you were building a house, right? You need a plumber, you need an electrician, you need a carpenter. We all have areas that we're good at and we are experts in, but each patient may need a different variety. One might need an endocrinologist for their diabetes, one may need a vascular surgeon, but one may not. You sort of need to take a team approach in order to properly address sort of each problem that may be affecting the wound healing process. And so that way, like I said, our infectious disease folks, the endocrinologists, surgeons, wound care, they all go together. And if you're just fixing one part of that, you may be missing the major reason why a wound isn't healing. And so having us all look at it, sort of make sure that all of those areas are being improved.
All right, thanks again. At this time, I'd like to pause and welcome our viewers again. If you're just tuning in, thank you and welcome. We're here today with our experts from the MedStar Health Wound Healing Institute, available in Washington, D.C. and Baltimore, Maryland. We're here to raise awareness and discuss wound care and saving limbs in honor of Limb Salvage Awareness Month. So if you or a loved one has a wound that won't heal, either in your foot or your leg, stick around, share this broadcast with your friends and your loved ones. Ask us your questions in the comments below, and keep watching to find out more information. Also, for your information, to request an appointment with our experts at the Wound Healing Institute. If you're in the Baltimore region or surrounding areas, you can call 888-839-6863. Or if you're in the Washington, D.C. region or surrounding areas, you can call 202-444-9686. We'll also share that information in the comment section for you. So at this time, let's get back to some of our questions. I'd like to pull in Simca Gratz into the conversation. She is our certified nurse practitioner at the MedStar Health Wound Healing Institute at MedStar Good Samaritan Hospital in Baltimore, Maryland. So Simca, what role do you play within the wound healing and limb salvage team?
Yeah, thank you so much for having me. So I mainly work in our inpatient setting here. So if any patient has a severe infection or has a need for acute limb salvage surgery, I play a major role in facilitating team communication. As Doctors Kuhl and Steinberg have discussed, our team here really plays, we really care strongly about that team collaboration to care for our patients. So we have Dr. Kuhl and her vascular team see a majority of our limb salvage patients to make sure that we can address any blood flow issues with them. We have our infectious disease doctors see our patients to make sure that if there is an infection present, we are treating our patients' bacteria or whatever organism that they're growing with the appropriate antibiotics. We talked a little bit about needing the endocrinologist for our diabetic patients to ensure that our diabetic patients have adequate glucose control. We also have, a variety of other team members that play such a crucial role to our team here, including our surgical PAs that assist with bedside care and as well as assisting in the OR. And we have our medicine teams here that take care of the comprehensive aspects of our patients' medical conditions. And my role in that is to help facilitate all of those team members being involved in our patients' care and facilitate communications between our surgeons and those teams, as well as making sure that we have everyone on the same page. We also have our PAC team here, which is our patient care coordination. That's a team that we have been grateful to add on recently to help facilitate ongoing care, both for our patients that are in the hospital requiring surgery and to continue following along in the outpatient setting to make sure if there's any resource barriers, we can have as much resources to help overcome those barriers as possible along our patients' continuum of care.
Right. Thank you very much for explaining that, Semka. Could you share also why educating patients about their diabetes and wound care is so important at an early stage?
Yeah, like Dr. Kuhl kind of mentioned, diabetes has such an impact on our patients' blood flow and can cause a decrease in their blood flow. So keeping that under control early can help prevent some of those severe complications. There's also a number of different pathways that diabetes can impact patients and lower extremity wounds. If a patient has diabetes, sometimes it can change their foot structure and cause increased areas of pressure, which can then lead to wounds. If a patient has damage to their nerves and neuropathy, sometimes that could lead to, things that like excess dry skin, which could cause some small wounds, which would be a portal of entry for bacteria or other organisms. The neuropathy can also prevent patients from being able to adequately feel their feet. So if they injure themselves or if they have, repeated trauma to their foot, even something as little as, say, a pebble in your shoe where you can't really feel it. So you have the repeated trauma on your foot, which can create a large problem for some of our patients. Some patients, could step on something and not realize it. So the neuropathy can really play a huge role in our patients and their foot wounds. And with the high blood sugars, you can also have impaired infection control with your white blood cells. So that can lead to more severe infections quickly. So those are some of the reasons why it's so important with patients with diabetes to really get their sugars well controlled and follow up with their providers to make sure that that's being addressed so that we aren't having more severe things as a result of that.
Absolutely. Yeah, it's good to get things early, catch things early, and be as preventative as possible. So thank you. Could you also share what the recovery process is like for patients who have limb salvage surgery?
Yeah, so a lot of our patients who have surgery with us, we do ask them to keep weight off of their incisions to help with healing. We don't want the incisions to break down and open back up because of the weight that they're placing on it. So a lot of times we do have modified weight bearing status, or how much weight you can put on your foot. Sometimes we ask our patients to not put any weight at all on their foot for 4 to 6 weeks. And so all of our patients that see us in the hospital here, we do have the rehab services see them, and physical therapy, occupational therapy, usually recommend our patients go to a rehab after their stay here or have some help at home with physical therapy and occupational therapy coming out to their home. So that way we can make sure our patients are strong and keeping that weight off the foot to allow for healing.
That's great. And speaking of that post-surgery process, are there any resources available to help patients?
Yeah, so I think Dr. Steinberg mentioned some of them earlier when we were talking a little bit about home health and physical therapy and occupational therapy. So we like to get our patients connected to those resources as appropriate. Our rehab team could also recommend some mobility aids to help keep weight off the foot, something like a knee roller, scooter, crutches, or a walker, things like that to help with moving around during the recovery process. We also have our PAC team, our patient care coordination team here, that could help with any resources that are available in the community and overcoming some of those barriers to coming back to see us. We also, once a patient has healed, could facilitate them getting special footwear or things to help offload and continue to prevent future wounds from developing based on how their foot is once they've healed. But I think it's really important to have continued follow-up with your surgeon and with your team so that we can continue to connect our patients with appropriate resources along their recovery journey.
All right, that's good to hear. At this time, I'd also like to pull in Patricia Muller. She's our physician assistant at the MedStar Health Wound Healing Institute. So Patricia, could you share more about your role at the Wound Healing Institute?
Hi, thank you so much. Simba and I share this office, so we're advanced practice providers. We just don't sit close. But as a PA, I work in the wound center, so I see outpatients, and they come in. So the limb salvage patients, before they get into their journey, we try to heal their wounds, and sometimes they'll need much more advanced care, and we pull the team in. That's one of my roles. I support our medical director here. He has a very busy wound center, seeing a gamut of patients, but my other role is being in charge of this hyperbaric medicine area. And we're very fortunate at our wound center. We can offer hyperbaric oxygen therapy to our limb salvage patients, which has a huge impact on their healing. And I'll tell you more about that. When the patients come in, it's such a pleasure to ask them if they qualify. They have to qualify to see if they can go into these dive chambers that we have here.
Yeah, I think that's a great segue. That was my next question about the hyperbaric medicine. So yeah, tell us more about that and how it helps to heal wounds.
Well, the oxygen we breathe is just 21% oxygen, and it's not under any pressure. It's just 1 atmosphere. But in these chambers, it's 100% oxygen, and it's pressurized at least 2 to 3 times our normal air pressure. So it's like going up in an airplane or diving at least 30 feet underwater. And that extra pressurized 100%, our lungs breathe it in, it gets into distal tissues, it goes everywhere, but it gets into these distal areas where it helps these wounds heal. It helps them build new blood vessels, new tissues. And at first you can't really see it in the first week or two. It's at a microscopic level. But as these patients come every day, Monday through Friday, for 2-hour dives, then you can really start seeing a difference in their wounds, improving, healing. Some patients actually have to have 40 dives, which is 8 weeks. They are very committed to, saving their limbs. They've had these wounds for a very long period of time, sometimes months or years. And when they see that hyperbaric can help them heal and close these wounds, they're all in. They dive right in.
Awesome. So could you share some of the most common questions that patients ask you about the hyperbaric chamber? And how do you explain that? If you Google it, it looks like a something pretty strange to be in. Could you tell people about the questions that you hear or any concerns that people may have with using that technology?
Like not everybody can come get the treatment. Like you need a referral from a doctor. So when they hear about, famous singers having it at their house, that's
right.
This isn't, even though it feels like I work in a spa, it's such a beautiful environment. It's not actually like that. It's they're mono chambers, so it's a big acrylic tube. It's a plastic chamber, and each patient gets their own chamber for the 2-hour treatment. And most people are really scared. They think it's like an MRI machine where, oh, I'm going to be enclosed, and they're claustrophobic. But they're pleasantly surprised that it's just this clear tube. They get to watch TV. Most people take a nap. And there's a lot of things that can't go into the chamber because it's 100% oxygen. We don't want anything blowing up. So we're very careful screening our patients and just reminding them what can go in and what can't go in. But most patients are just surprised when they see the chamber, the size of it, how comfortable they'll be, and things that are allowed, not allowed. I ask the patients a lot of questions because they, beside being appropriate diagnoses to go in and be able to treat, they have to be safe in the chamber. They can't have a history of collapsed lung or unstable heart failure conditions, because the pressures in those chambers have a physiologic effect. So my job is to make sure everyone taking a dive is going to be safe in the chamber, going in, coming out, and that they're also ready for the commitment. It takes a lot to come here Monday through Friday. This isn't taking a pill at your kitchen table every day and you're done after a sip of water. This is a commitment of 2 hours a day, Monday through Friday, sometime for 3 to 8 weeks.
All right, thank you very much, Patricia. I have an audience question that came in that I think is a great segue from your last point about hyperbaric medicine. So this comes from Jenny. Thanks for tuning in, Jenny. They ask, can hyperbaric medicine prevent the need for surgery?
Sometimes it depends on the wound location, and with the rest of the team's input. Is the vascular flow good? Is the infections taken care of? Was the diabetes under control? Were other things in line, all working together to prevent surgery and an amputation? So a lot of times it has healed a wound and prevented, further intervention.
And I would just add, Mihan, that hyperbarics, a lot of times, even after surgery, we have trouble healing the wounds, and hyperbarics can be a tremendous help for the non-healing surgical wounds. So you may have done everything right in the operating room, but now you have this wound that still doesn't have the oxygen to heal, and the incisions don't seal. So hyperbarics can be fabulous for helping improve that surgical result, or saving what's called a flap when a plastic surgeon does a relocation of tissue to help make sure that survives properly and heals. So a great adjunct to surgery, if it doesn't sometimes always prevent surgery.
Good point. Good point. Thank you very much, Dr. Steinberg. I have one last question for you, Patricia, at this time. So I've heard that you worked in the emergency department. So how did that prepare you for your new role in wound care?
I did get to work in the emergency department for at least 15 years, but before that, I took care of burn patients, and that segued into my emergency career. But taking care of a burn patient is like a limb salvage patient. They're very unique. They have a lot of unique needs, and it takes a lot of people, a lot of different specialties to come together in the same way. So what's called a multidisciplinary team. Everyone comes from a certain discipline, whether it's nutrition, therapy, surgeons, nurses, technicians. They all come together with their special skill sets to help patients heal. And I think that seeing burn patients really gives you a different empathy for people. And I know how painful these wounds are. Even patients who have diabetic neuropathy, they can't feel their feet. They go through so many challenges. And I think our multidisciplinary team approach helps the patient in a holistic way, because it's more than just treating these medical needs. Our patients have a lot of social needs, emotional needs, and we have a lot of resources to help them with our PAC team, our community health advocates. And we're very fortunate at MedStar that they really support our program, and it benefits the patients.
I like the sound of that. Sounds like a holistic approach, addressing the needs of the patient. So that's really encouraging to hear. So thank you again, Patricia. At this time, I'd also like to turn to Dan Hakim. He is the Director of Clinical Operations at the MedStar Health Wound Healing Institute at MedStar Franklin Square Medical Center. So Dan, you trained as a physical therapist. How did that help you with your role in wound care?
Again, thanks for having me here. And that's a great question. A lot of patients and healthcare providers don't realize the role that physical therapists can play in wound healing, and occupational therapists as well. So as a physical therapist, there's a lot of modalities like therapeutic technologies like ultrasound or electrical stimulation. People think about using them with athletes or people that have regular musculoskeletal injuries. But in a similar fashion, those modalities can be used to heal open wounds. So same collagen bridges we're trying to build, right, to fix a tendon or to fix a ligament. We can use those to help heal wounds faster. The other piece as a physical therapist that really comes and is brought to the team is viewing the function of a patient. So how do we restore function in light of this wound that's open? Dr. Steinberg and Dr. Kuhl and everyone has kind of talked about, some of these wounds can be extensive. They can last, unfortunately, a fairly long period of time. And as Simca mentioned, sometimes you can't put weight on it, right? Let's say the wound's on the bottom of your foot. It's very easy for us to just say, oh, you can't step down on your foot, so no walking for the next 6 months while your wound heals. Well, that's just not realistic. That's not life. People can't do that. People have to work. People have to go to school. People have hobbies, activities, play sports, whatever it is. So not just treating the wound, we have to make sure that we are maximizing function while we're promoting healing, and that those go hand in hand. So we're really getting people back to their lives as quickly as we can.
That's fantastic. It makes sense that you would need to know how to move around as these wounds heal. Even the logistics of everything. So yeah, it's a lot to consider. So also, what are the most common questions that you hear from patients?
So there's lots of questions that come kind of from every different angle, but I would say one of the most common we get in general is a lot of people ask about leaving their wounds open, or whether they can take a shower with their wound open. We have all sorts of fancy dressings and fancy bandages that we apply. Some of them can be quite cumbersome, but they're necessary for the wound to heal properly. So in general, we like to tell people not to leave your wound open to air. So these are patients, especially if it's a chronic wound, there might be lots of medical complications with the patient and you're at high risk of infection. Leaving the wound open and not covering it just leads you more susceptible to getting an infection. As far as showering, each provider, sometimes some surgeons have a different perspective than others, so you definitely need to check with your individual provider. But again, in general, it's better if we can keep these wounds protected and keep them covered. The less extra stuff we're adding into the wound, the less likely we are to get an infection and then heal correctly.
Okay. And why do you think it's important to visit a specialist for wound care?
So I think the main reason that you go see a specialist is because they bring a perspective that other people don't have. There's hundreds of different wound care dressings out there. There's new technologies that are coming out every day. This wound care team, the panel of different experts that you see here, they're on top of their field and they're learning what's the newest, the latest and greatest that's out there for wound care. So for anybody, especially if you're at high risk, or if this is a chronic issue, you want to go to the folks that have seen the most cases, have seen the complicated cases, and they have kind of the history and the understanding to make sure it relates directly to your care.
All right, thank you. I have a few other questions, and I'll pose this to the entire panel, so feel free to jump in as you see fit. So I have a question about blood sugar. So how can someone's blood sugar affect the way that they heal?
We could all comment on that one. It's such a pervasive concern and such a hard one to control. Working with patients to try to keep that blood sugar controlled, particularly after they've had surgery. So if you've had to do surgery for the wound, or they've had to have a vascular procedure, any type of incision, if your blood sugar goes over 150 during that 2 to 4 week period after your surgery, your chances for a complication skyrocket from it becoming infected or the skin not healing. So it's such a challenge, and it's a daily challenge, and it's something that we really try to get our patients with the right resources. A lot of it's about education and helping the patient understand how important this is. And I know you can't feel it when your blood sugar is high, but monitoring that regularly and really doubling down on, did we get the right advice for your medications? Is that medication plan working for you? And what can we do to tune that up? I think my approach is making sure the patients know how important it is to wound healing. I can't do that for them, but I can make sure they know how important it is to control it.
All right, and also for the entire panel, how does smoking affect how a patient's wound heals?
can answer that.
Okay.
So this is actually, I probably should have mentioned it before, of how to prevent some of these from happening. Smoking can negatively affect how wounds heal in multiple ways. Number one, as far as a blood supply to the wound, smoking is probably the biggest cause of the plaque buildup in arteries in the legs, even more so than to the heart, to the brain. The majority, probably 75% of folks who ended up with particularly bad atherosclerosis in their legs are or were smokers. And it's probably, apart from diabetes, the number one modifiable thing that we can do to help increase the blood flow to the legs is to stop smoking or to not start smoking, because that will increase your risk of poor blood supply to your extremities. The other thing is just the toxins and the nicotine within the cigarettes actually cause your blood vessels to constrict. And so even apart from sort of the chronic and lifelong damage that it does to the blood vessels, on a small vessel level, when you're trying to heal a wound, that nicotine will actually constrict those blood vessels and further prevent that wound from healing.
All right, and I have another question. How soon can someone walk if they now have a prosthetic leg or foot after surgery?
So a lot of that is going to depend on the specific procedure that they have, you know, and that particular surgeon. Once the wound is stable, and you know, and the incision site is healed, we want folks up and walking as soon as possible. So there are some prosthetics that are designed, temporary prosthetics that are designed immediately post-op, that you can put them on. They're kind of built out so they don't affect the incision. So we can get weight bearing right away and start working and training and be more aggressive. And then again, depending on the individual person, maybe we're going to go a little bit slower, make sure that wound is fully healed before we get that prosthesis on and get moving around. But yep, as soon as we can get people up, we want them up moving around.
Yeah, I totally agree with Dan on that. And there's two parts of that too that we would add, is that the walking on the prosthetic may take 6 weeks or so until they get a full step on the prosthetic. But as Dan said, we're getting them up and around with maybe they can't bear weight on that part of their leg yet, but let's get them up out of bed and get them moving and make sure they've got the right support through either inpatient or outpatient physical therapy and occupational therapy that can keep them moving. Because every day that you are sitting and lying in bed is going to take 2 to 3 days to recover, if not more, each time. So.
All right, thank you very much for your feedback. As we close, I'd like to go around the room to all of our experts and get your final thoughts. Anything that you would like to share with our audience today. So I'll start with you, Dr. Steinberg.
Sure. Thank you again. This was really fun to be able to see the team on the screen here and get to chat about what we do. I think one point that I neglected to mention when we first opened up in comments is I'm a podiatrist. I'm a podiatric surgeon, so foot and ankle is my specialty. And that's an area that I would like to just kind of make sure people know we've come a long way from 10, 15, 20 years ago in what we could do for a foot wound. And we've learned so much about tendon function and what we call tendon and soft tissue balancing now, where we can do small procedures in lengthening or transferring a tendon. We can elevate or move a bone around. We can deal with the mechanical structure is such a big deal because you're walking on your foot, and therefore those pressure areas lead to ulceration. So we can fine tune those pressure areas and relieve that. That's one really neat area that's a big part of my practice now is the surgical offloading is what we call it. So if we can help make the foot function a little better, we'll have less chance that there'll be another wound around the corner.
That's good. That's good to hear. At this time, I'd like to turn to Dr. Suzanne Cole. Any final thoughts?
Basically, thanks everybody for this. It's been nice to chat with everybody, as we often do, about our own patients, but to share some of what we do. I think as we've sort of talked about, a non-healing wound, that typically a wound will heal, or sort of we take that for granted. And so I find often patients sort of just want it to get better, and I appreciate that, and we want it to get better for you too. That I think sometimes we just think, oh, this will get better on its own, and take a while to sort of reach out, or sort of don't know where to reach out when it's not going the right direction and things are getting worse. And so I always think that it's better to sort of get it checked out sooner rather than later. If things are looking red, if there's drainage, if you cut yourself a week ago and it doesn't look like a normal healing wound, to get in, call the wound center, call your primary care to, get us plugged in. But the sooner that we can address some of the problems, the more likely we are to be able to get it to heal with less tissue that is lost and less function that is lost. So if you think something is off, trust that gut and let us help.
Thank you. Thanks again. Simka, any final words for our audience?
Thank you. This was a great discussion to have with all of the people here today. So I'm so grateful to be able to come on here and share more. Like Dr. Cole was mentioning, that we are here to help for all of the patients that think that they may need our services. We have a great team here that involves so many different specialties, and we are very grateful for every specialist support for our team here. So yeah, if you or anyone have any concerns where you think that you would need our services, we would love to hear from you.
All right, thank you again. And Patricia, anything that you'd like to share?
Oh, well, having worked in the emergency department and helping elderly parents out, like anytime someone falls, but you don't have to be over 65 or 75 to have a skin tear or a wound. You could get new shoes and have breakdown. But even our younger patients who are in their 30s and 40s who have diabetes and smoke may develop like an accidental wound, and they may be like, well, why isn't this healing? And they go to a primary care doctor, urgent care center. So I would encourage them, just by listening to this broadcast, to know that we're a wound center that can help them out, because the bottom line is they want to get back to life. Summer's coming and a pool is waiting.
Absolutely. I like the sound of that. Thanks again, Patricia. Dan, anything that you'd like to share?
Yeah, just to kind of second what everybody's saying, there's a lot of home remedies out there. We see, our grandmas all had kind of ways that wounds are supposed to heal. And, when we're 12 years old and nothing's medically wrong with us, no matter what we do, our wounds will heal. Our body is pretty amazing at kind of doing that for us. But as we get older, we have poor circulation, we get medically complex. We need a little help sometimes. The longer that wound is open, the harder and harder it gets to heal. So one of the rules of thumb we usually say is if you've been doing something for at least 2 weeks and you're not seeing improvement, you need to get yourself somewhere, make sure you're seen, make sure you get to a specialist. Let's find that underlying problem and get it fixed before it becomes a major issue.
Absolutely. Good words to live by. Thanks again, Dan. That wraps up our broadcast. Thanks again to all of you, our viewers, for joining us today and learning more about wound care and limb preservation. Many thanks to all of you on our panel today. Thanks again for your time. We really appreciate it. If you'd like to request an appointment with our experts at the MedStar Health Wound Healing Institute, if you're in the Baltimore region, you can call 888-839-6863. Or if you're in the Washington, D.C. region, you can call 202-444-9686. You can also visit our website, medstarhealth.org/wound healing. We're going to share all of that information for you in the comments below. All right, thanks again for your time, and we will see you next time. Bye.
Thanks so much.